From a county perspective and the way that we operationalize our services through family home visiting, women have the opportunity to connect and meet with a home visiting nurse or a home visiting social worker, and they get to learn about the processes that take place in the clinic setting and in the hospital setting to help ease their fears. And from a hospital experience, we now here in Beltrami County at Sanford Healthcare use Eat, Sleep, and Console to manage the care for women and for their children when women do struggle with substance use disorder or chemical dependency. So when a woman or her family gets involved with our home visiting services here at Beltrami County, we have a unique collaboration with our social service department and our economic assistance department and other community partners in the community, where we work hard to establish relationships and referrals to other services that are available that best meet the needs of that individual. One of the things that makes home visiting services unique compared to some other programs is that we don't have a strict set of guidelines on we're only able to refer to this program or we only are able to offer this type of service. We can create a plan that's based on the individual's goals and the individual's needs. When a pregnant person goes through a drug screening process, it helps staff identify what substances are in their system and what potentially substances could be impacting that infant. And so when the baby is born, it helps identify the best course of treatment for maybe drug interactions, or to help explain maybe why a baby is so fussy, or maybe why they have diarrhea and then get a diaper rash, or to be aware of changes from kind of a routine delivery. So maybe that baby might struggle with respiratory issues. And so we see, we're prepared that maybe we need to have oxygen ready for that baby. From a public health perspective, understanding the substances that an individual is using is really important to be able to provide the right education. And so that is why we do early detection with substance use through a urine drug screen. So when I first relocated to Bemidji, I was the inpatient manager for the Women's and Children's Department at the Sanford Hospital. My boss at that time had asked me to investigate Eat, Sleep, and Console and to see if it was something that we could bring to the people of Beltrami County. At the time, our current treatment for infants that were born and going through withdrawals was to use a scoring system called Finnegan's. Finnegan's was pretty simple as far as the baby got a score, and based on that score, determined whether or not the baby would be started on morphine. But through the research that I did and the community partners that I connected with and a collaborative that I joined across the state of Minnesota, we learned that Eat, Sleep, and Console was a much better way to manage the care for not just the infant, but the mother and their support system. So with Eat, Sleep, and Console, we simply identify how is the baby doing sleeping, how is the baby doing eating, and how is the baby doing with being consoled. We use that scoring system to identify, does the baby need additional treatment, different management, and do we need to provide better education to the mother and their support system. With Eat, Sleep, and Console, the baby is less likely to need to be on morphine. The baby is more likely to get better bonding time with the family because they stay in the room, and the baby is less likely to have to spend a longer time in the hospital, And that baby is usually a lot quicker to go through the withdrawals in a more comfortable manner because they get to stay in the room with the primary parent and or their support system. So with Eat, Sleep, and Console, it was a project that was not only geared towards providing better care for families, but helping families go home with their babies to increase bonding and that connection, which is so crucial. Identify families that could breastfeed, that would struggle with breastfeeding because their babies were in the nursery instead of in the room with them. With Eat, Sleep, and Console, we teach families how to be more responsive to the baby's needs when they are going through withdrawals. We're teaching them to have quiet environments. We're teaching them stress-reducing techniques. We are teaching them how to understand baby's cues, whether a baby is fussy, baby is tired, or a baby is hungry. Beltrami County Public Health Program, we do a pretty extensive intake process when we are first meeting with clients. And part of that process is identifying whether or not an individual has a history of substance use or chemical dependency, is currently struggling with substance use or chemical dependency, or is at risk. And by assessing for one of those three things, it allows for staff to know how to better navigate the home visit, prepare for conversations and education, and also how they can better support the individual in meeting their goals. They can identify risk factors. And so maybe a mom texts or calls the home visiting staff and they cancel 3 appointments. The staff will know better how to respond to those cancellations. If there's concern for maybe somebody relapsing or somebody maybe starting to use, they'll know better how to navigate those conversations. Doing those assessments and having a baseline for the clients that we serve, it creates a opportunity to build trust with people. It also creates an opportunity for staff to be prepared for when they maybe reach some of those barriers, or they reach out and say, I'm really struggling today. They know then the right resources, pretty immediately to connect an individual with, because they have that baseline from their initial assessment. Beltrami is really the rural hub for the Northwest region, and so we have access to a lot of resources. It's just knowing where to find those resources, and that is another unique thing about having a home visiting nurse or a home visiting social worker, because that's an individual that our clients can reach out to and say, hey, I'm struggling with, I'm feeling really sad today, and my money from my paycheck wasn't enough to put groceries on the table. We can help them. And that's a preventative thing for somebody to maybe relapsing, or that could be at higher risk for using substances. So it's not always like the really big, heavy things. Sometimes it's just identifying some of those, what to some of us might seem like a small thing, but it could be a huge trigger for another individual. One of the favorite things for me about being when I was a home visiting nurse was giving my clients my work cell phone number, so they had direct contact with me. So they weren't trying to play phone tag with me when I was maybe out in the field all day. Having that one person that maybe you feel safe with. One of the things that I love about our home visiting staff is they're super creative. So we identify different things that help clients feel safe, help build trust with them, but also like what gives them joy. And so for one person, it might just be getting a shower for the day. And so our nurse can go into the home, or our social worker can be visiting and doing their assessment. And they might ask a simple question like, when's the last time you had the opportunity to take a shower uninterrupted? And so while they're doing their assessment with the baby, mom maybe is going to get an opportunity to get an uninterrupted shower. So sometimes it's the resources, sometimes it's the education, sometimes it's the atta girls, right? Like, you're doing a great job. Like, your baby's growing, your baby's meeting the milestones. And even when they are struggling, it's that person to listen, to comfort them, to have empathy with them, and to help encourage them to stay on track and know that they're going to get there. With prenatal care engagement, it allows for early intervention and early identification. And in the home visiting world, it allows for us to let our clients set their goals. So a lot of times in the medical side of things, we have goals that are already set for us. We use a lot of evidence-based practice where it says, this is your goal, and then you need to meet that goal, and here's when you need to meet that goal by. But from a home visiting perspective, we get to come into the home and say, okay, what are your goals? And it might be, I want to be able to breastfeed, or I want my baby to not have diaper rash. It might be simple goals, or it might be, I want to go back to school. I need help finding daycare. It might be, I want to be able to make all of my prenatal appointments. So we can help with transportation. We help meet those goals wherever that person is at. And that's one of the things that I really appreciate about getting that early connection for the women in our community. And one of the great things about public health is, unlike other programs across the state, anybody can have a home visiting nurse. So it doesn't matter if you don't meet income guidelines or it's your 5th baby, there's no requirements. So you call public health, you connect with us and say, I want a home visiting nurse. And then we see what your needs are, and we try and match you with home visiting staff that would best meet your needs.